welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, kidney stones are hard deposits made of minerals and salts that from inside your kidneys. And so to discuss the symptoms and treatment of kidney stones, we have with us in studio Dr. Arup Kumar Nath, a chief consultant urologist. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Dr. Arup Kumar Nath, for coming to Good Life, the health show. So kidney stone diseases, it's a very common thing which we see these days and we hear about it. So if we talk about kidney stone, the name says it all. So what would you like that? How would you like to define it?
Yeah, kidney stones, as you already said, that the name says it all. It is formed in the kidneys, either kidney or both the kidneys. It is formed, and when it is very small size, it comes out automatically.
Okay.
But when the size becomes bigger, sometimes you may need to take it out.
Okay.
Or sometimes it becomes too big and it may sometimes even damage the kidney.
Okay. All right. So is there anything to be scared of? Because when people hear about a kidney stone, so they always get scared of that what will happen next. So there are treatments, there are precautions to take up. So if we talk about the scaring part, is there anything to be scared of? How would you tell that to the viewers?
If you see the kidney stones, almost 15% of today's population suffer from kidney stone, and the problem is the kidney stones increasing with each passing day.
Okay.
With day by day, it is increasing.
It increases with passing day.
Yes, yes. With each passing day, the incidence of kidney stone is increasing.
Okay.
Though when it is very small, it comes out automatically, as I have already said. And if we detect early the stones, if it is very small, we can take it out with medicine. And if it becomes too big, then we need to take it out by endoscopic method or keyhole technique or laser. And sometimes in neglected cases, sometimes it may damage the kidneys, one or both the kidney. So yes, it is, even if it is not scary, it is a serious issue. Yeah.
So how does it get forms? If we talk about the daily lifestyle which we are leading and the food habits which we take up, so is it anything related to that or something against that?
Okay. If you see the composition of kidney stone, it is mostly calcium, oxalate, then uric acid, the cysteine, indinavir, phosphates. These are the things, and mostly these are the things which comes in our food only to the body, and sometimes even in some drugs like HIV drugs, indinavir. That also helps in formation of indinavir stone, and sometimes in some conditions the body also produces some of the minerals which helps in stone formation.
So can we say that it creates inbuilt, it creates itself?
Yeah, sometimes like calcium formation, like in hyperparathyroidism, in some condition of the parathyroid gland, hyperparathyroidism, there the stone formation is increased.
Okay.
And in some cases where there is a resection of small bowel, in that case, the oxalate, which should actually should get excreted from the body, is absorbed to the kidneys. In that case, that oxalate stone formation increases. There are some other condition also, like congenital condition, birth condition, like blockage in the kidney, PUJ obstruction. There are one condition called both the kidneys are attached, called horseshoe kidney. In that condition also, the chances of stone formation increases.
Okay.
And some condition like environmental condition.
Environmental
Yes. That desert region where there is very high temperature leading to dehydration in the body. And the mountains, like in Northeast, people get in some places less water to consume. And some people, they used to work in very hot climate, very hot atmosphere. And some people like us, the surgeons, we operate for long hours.
Okay,
sometimes
so
8 to
less
10
water
hours.
consumption is also one of the key factors of a kidney stone.
In some condition, like it runs in families also. Like in some condition, colorenal tubular acidosis, medullary sponge kidneys. These are the condition where it runs in families. So you will get the more and more people in the family to have kidney stones. So mostly, if you see the basic concept of stone formation, it is the deficiency of water in the body.
Okay,
so any of the condition
the
leading
body
to
is not properly hydrated.
Yes.
So this is one of the key reasons, and we are trying to make you aware about what are the things that can make you aware that how can you get rid of kidney stones and what are the signs and symptoms. We will try to discuss that, but we would like to tell our viewers that the numbers are flashed on your television screens, and And if you have any queries regarding the topic which we have taken today, that is a kidney stone diseases, so you can call up. Dr. Arup Kumar Nath is in our studio. He will give you all the answers. All right, coming back to you, doctor, again. So now talking about the food habits everyone is taking these days and the lifestyle which everyone is leading. So if we talk about the food habits, if someone is ill for some reason and they take the medicines without any prescription or any without any guidance, so it is said that if you take a lot of like antibiotics and all, it is going to affect your kidney. So is it something true, or it's a misconception about the people?
Not actually. Yes, definitely.
A lot of medicines.
A lot of medicines.
Take, lot
yes,
of medicines.
Yes. Whatever medicines we take, the medicines has to go out of the body and either in urine or in the stool. So most of them gets excreted through urine. So the kidneys have to filter the drugs. So some drugs which has negative effect in the kidney, and the most common of them is the painkillers.
Okay.
So these are the drugs should not be taken without proper consultation and without proper advice from a registered medical practitioner.
Okay.
Over-the-counter painkillers can injure and completely damage the kidneys.
All right.
There are some antibiotics, some anti-cancer drugs. There are some other drugs also which affects the kidney. So whatever diseases or the problem any person will have, he has to consult one doctor and take medicines, not over-the-counter medicines.
Over-the-counter is not at all prescribed. And doctor, let's talk about the signs and symptoms quickly. And if people will get to know, how will the people get to know that there are some signs and symptoms which is showing that they are having some problem in their kidney?
Yes. The typical of kidney stone is the pain.
Is the pain.
Yes, we call it renal colic. It is felt in the back, just below the ribs and a little outside the vertebra. That is the area we call renal angle. So the colicky pain, which is an on and off kind of pain. It is not continuous. Initially, it is on and off kind of pain. It comes and it stays for some time and then it goes.
Okay.
And once the stone, which drops off from the kidney to the ureter, then the pain becomes very severe.
Okay.
In that condition, the pain also, it moves from the renal area, it goes to the lower abdomen and then inner side of the thighs and the groin area. So we then call it the ureteric colic. It is very severe. Once the patient comes to emergency department, we come across this kind of patient. They are in severe pain and tossing in the bed for some relief. And after some time, it again goes, again comes.
All right, so does the pain take the severe stage at first go, or does it take slowly?
Mostly,
if you talk about the pain.
The renal colic is mild kind of pain. And once it comes to the ureter, it blocks the urinary flow, that normal passage. So which urine comes from the kidneys towards the urethra and the bladder. That tube is called ureter. And this is a 5 millimeter size small tube. Small tube. So if the stone is big enough to block it, then there will be severe pain that is called ureteric colic. And sometimes when there is infection, the patient will have fever and there may be hematuria also, that is passage of blood in urine. And sometimes, as I have already told, that kidney stone may damage the kidneys. If both the kidneys are damaged, then there may be signs and symptoms of kidney failure.
Okay.
And the one difficult condition is like approximately 10% of patients, there may not be any symptoms. We call it a silent stone, and that is more dangerous because without any symptoms, sometimes we come across patient who comes for the first time and the stones detected for some other reason.
Okay.
When patient comes and attends a doctor for some other reason, and nowadays as ultrasonography is a very regular investigation and available also. So most of the doctors used to advise on ultrasonography. And then a stone has been picked up, and when we do the functional analysis to see the function of the kidney, we sometimes find that the kidney is already non-functioning.
Okay, there is a misconception or there is a confusion amongst everyone, and I also have a little doubt that talking about the kidney stone and gallbladder stone, is it similar or is it something different? Like people confuse it a lot.
Yes. Stones, gallbladder stones and kidney stones are different entity.
It's different entity.
Yes.
Okay.
Though the symptoms sometimes may be similar because it is pain. Gallbladder stone also, the number one symptoms may be pain. And for kidney stone also, the number one symptoms will be pain. And pain, if it is in the right side, will be similar to gallbladder stones, pain of gallbladder stone.
Okay.
So again, picking up the initial investigation is ultrasonography. Both the things can be picked up by ultrasonography.
All right.
And treatment-wise, it is different because
treatment-wise is different.
Different. Because if there is a gallbladder stone, it needs removal of the gallbladder.
Okay.
And if there is a kidney stone, we'll not remove the kidney.
Okay.
We'll save the kidney and remove the stone. And as we have already discussed, that all the stones actually do not require removal.
Okay.
If it
all
is,
the stones doesn't require any like treatment or something like that. We will have a proper discussion on that. But right now, viewers, we'll slip into a short break. But do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion on kidney stone diseases with Dr. Arup Kumar Nath. So I'll straight away move to him and talk more on the topic which we have taken today. Doctor, coming back to you, earlier to the break, we had a discussion on the signs and symptoms and also on the differences between a gallbladder stone and a kidney stone. Okay, now let's talk about the treatment part. Do we have to operate for all the kidney stones, sir?
No, definitely not. The guideline says that stones up to 10 millimeter can be dissolved with conservative treatment and some medicines which dissolve the kidney stone. But practically what we feel and what we are practicing, that stones up to 7 millimeter can be treated conservatively, and we increase the water intake, we give dietary restriction chart to the patient, and at the same time we give dissolving medicine, and from time to time in 3 to 6 months interval we used to follow up the patient with a ultrasonography. But if the stone is more than 7 millimeter, it needs some kind of surgery, and we are doing now endoscopically, no cut, no stitch treatment, and gone are the days when big incision has been made in the abdomen to remove kidney stone. We are not practicing that, and we are now in the age of laser, where stones can be removed without any cut or stitch in the body.
And in fact, the patients and the attendants also have got a great relief with these kind of treatments which have already evolved nowadays, and lots of equipments have also been advanced these days. So we have also heard, Doctor, that you have been called as the laser man. So what is it all about? If you would like to put some light on this to our viewers.
Actually, lots of people used to call me that nowadays. Actually, we started the laser treatment in Northeast. Yes. Laser treatment of kidney stone, prostate, different techniques. We started, then popularized it. And that is the reason why people are calling this. And even in national circuit, people are recognizing us. And people from different part of India and even abroad, people are coming to our place, the center AUKD, to get trained. And in last 1 year, we have trained nearly 30 urologists from different parts of India and abroad. And that is a very proud moment for all of us.
Of course, and it gives you an immense pleasure when you treat such a long number of people, and it's a good number of people, and they give you all a pleasure that the things have worked out, and it gives you an immense happiness itself. So if we talk about the laser treatment, doctors, if I ask you about the like cost, or is it like too costly for anyone to afford it, or what is it all about if we talk about the cost part?
Yeah, the impression was like laser is a costly treatment till not too long ago. And it was actually a costly treatment because the laser machine costs a lot. But nowadays we are working out a plan, a daycare treatment plan where we do not admit the patient. The patient comes on empty stomach same day, and we operate, and by evening we ask the patient to go, and he becomes fit enough to go back walking. So that way we can cut down the hospital admission cost by 2 to 3 days, and they do not have lots of work loss also. That way, if you see conventional treatment where there is a huge work loss of 7 to 10 days and hospital admission for 2 to 3 days. So that way laser treatment is possible on daycare basis, and we are doing lots of laser technique, and that way by cutting cutting down the stay and workloads. Actually, if you compare nowadays, laser treatment this way as a daycare procedure even becoming little economic to the conventional
because
treatment.
Here in Northeast, what we see is that they have to do a lot of like compromise of if we talk about the treatment and talk about the expenses. So if you need to tell them that this is what is all about, so what would you like to tell them?
No, this is the thing that we are trying hard, and we are working tirelessly. All of my team and my co-urologists, we are working tirelessly to increase the awareness for early diagnosis and treatment.
Okay.
And for laser treatment, not possible for too big stone.
Okay.
So for a person to get the advantage of laser surgeries, the stone should be less than 15 millimeters. So we need them to get diagnosed early.
Okay.
So in that case, we can give laser treatment as daycare basis. The cost will come down. We are trying very hard to make laser treatment affordable and accessible to the people of Northeast.
All right, let's talk quickly about the prevention, doctor, and what about the diet part, like how people can take care about the diet themselves?
Oh, it is very important to prevent kidney stone from occurring and from recurring. When a patient comes to us, then we need to tell them, and clearly they should understand that for kidney stone, it definitely have recurrence. Up to 50% cases of kidney stone may recur because the kidneys will be there, unlike the gallbladder where we remove the gallbladder. Here we are not removing the source. Though kidneys are there, so there are chances of recurrence, and which is seen up to 50% of cases. So here what we do, we stress the importance of doing regular checkup, even by a simple investigation like ultrasonography, and after that we ask them dietary restrictions, like we ask them to take more water and less of animal proteins than coffee, tea, then these foods which have lots of uric acid, like non-vegetarian food, animal proteins, then carbonated beverages, then spinach. These are the things.
These are the things like one can include in their diet, and these are things which is easily available at your home, and you don't have to think about it. How can you purchase it, or how can you make arrangements for those things? So these are very easily available.
Yes. These things should be avoided, and they can take more of water and those citrus fruits and the fruits which have lots of water content.
Lots of water content.
That way, we can at least prevent the stone recurrences by around 40%, and it will come down to less than 10%. And we give this leaflet to patients, and dietary restrictions are free of cost in our center.
All right, doctor, we are really short of time. So as we are like giving awareness and also awareing people about the precautions to be taken and not to be scared about coronavirus. So I would also like you and request you to tell our viewers that what do you think, and how would you like to tell the viewers not to be that scared and be precaution, and precaution should be taken up very strictly. So what are those things, and what are the fine lines you would like to tell our viewers on coronavirus as well?
Coronavirus, which is called the COVID-19. That is coronavirus detected in 2019. So the worldwide now it is becoming a pandemic. People are very much scared because they think that there is no treatment, there is no vaccine. That is the reason why people are so much scared. But it is not that people should not get panicked, because though it is very highly infective and contagious,
proper precautions can be taken.
Proper precaution can be taken, and the mortality means the killing power of the virus is very, very less. It is only 3 to 4%. And if you say every day, lots of more people are dying of cancers, more people are dying of road traffic accidents than coronavirus. So people should not get that much panic. They should take precaution so that it does not get infected from one person to another by repeated hand washing. Yes, repeated hand washing, not touching the faces, then taking hot beverages, avoiding the cold things. So these are the things, by simple maneuver, the contamination of the virus can be aborted.
All right. Thank you so much for those good words. I'm sure the viewers who have watched our show must be benefited. And thank you so much, Arup Kumar Datta, for coming to our show. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.